Good evening, ladies and gentlemen. I'm Steve Laragakis, bringing you Division News at 6, or whatever time it is. Thank you for joining us. Tonight, we're bringing you the developments at the White Rock South Surrey Division of Family Practice. This has been a busy and successful year for the division. Our current membership is now at 117, including 2 NP associate members who were able to join the division after last year's bylaw changes. Our operating budget is $1.5 million, coming to us from various sources and helping us carrying out the 18 projects currently. Your board recently identified several priority projects for our 4 staff members to work on for the coming year. We are following these projects closely and will provide updates as developments unfold. And now, here is Deborah Harper with tonight's top stories on attachment.
Thanks, Steve. The big news story for tonight is the success of the Attachment Initiative, now known as the GP for Me Initiative. It has been estimated that the White Rock South Surrey Division has been able to attach over 12,000 patients to family doctors in our community. That's an amazing number. We want to thank our members for their hard work and cooperation in achieving this goal. In fact, in the last 3 years, the division has been able to provide a list of physicians taking new patients to White Rock residents. This list is located at the Central Registry. We are only one of a very few communities in BC that can do that. Recruitment and retention. This remains a high priority for the division. We have come to realize that attachment is a fragile concept. Although we were able to welcome 8 new physicians to our community this year, we are also bidding farewell to 4 long-serving family doctors. Finding locums for our hardworking GPs has also been a challenge for the division and remains a primary concern. Last year, thanks to 5 family physicians, the division was able to fill 24 locum requests. The Primary Care Access Clinic, another success story. A recent evaluation report referred to the clinic as one of the most dramatic improvements in being able to provide care for our most vulnerable patients. The clinic is staffed by a part-time GP, nurse practitioners, and mental health workers. These hardworking folks have been able to provide care for over 600 at-risk patients, many of whose needs could not be met in the traditional practice. In summary, there is much more to be done under the Attachment Initiative, and we will look forward to bringing you up to date as new events occur. Over to you, Steve.
Thanks, Deborah. Funding for the Attachment Initiative, or GP for Me as it is now known, will end in March 2016. Projects will either wrap up then or be sustained through other funding models. In other news, hospital care continues to be an important area for many of our members. Here's Dr. Connie Rufo to give you an update on hospital care. Over to you, Connie.
Thanks, Steve. We've been talking about this a lot in recent months, and the latest survey shows that the night doc pool is now down to 16 physicians. This night doc program enables 29 community GPs to be able to continue to provide hospital care for their patients. In other news, the division is working closely with Fraser Health to resolve issues at Peace Arch Hospital that physicians identify as difficult and frustrating when trying to provide good patient care. We're going to stay on this story night and day, Steve. Along these lines, the division is working on a shared care project to help improve communications between hospitalists, community physicians, and specialists. The first meeting of interested hospitalists and community GPs was held earlier this month. Watch for updates on this Transitions in Care project. And now, back to you, Steve.
And now for a special report on residential care from Bob Shane.
Thanks, Steve. Just finished the office. The White Rock South Surrey Residential Care Program recently expanded to include coverage to 2 private facilities, Whitecliff and Westminster House, thanks to the new funding model offered by the General Practice Service Commission. The medical directors are Dr. Sidney Field and Dr. David Zayons. This new model was implemented in July of this year, complementing the coverage offered by some GPs as site medical directors at the 9 publicly funded care facilities. The division's residential care model is being used by other divisions to implement similar programs in other communities around BC. Significant benefits from this program. A recent evaluation of this program indicated our model of 24/7 has resulted in a 60% reduction in unattended emerge transfers from our facility to hospitals. Secondly, the facility staff appreciate the improved access to physicians. Also, physicians are actively engaged in bi-monthly meetings with an educational component. And lastly, the MRPs have access to the site medical directors to assist with their care.
Excuse me a moment. I've lost my microphone. Yes. We interrupt this broadcast for breaking news. We have Nancy Mathias in the field.
Thanks, Steve. I'm here with Dr. Arya Moreau, a recent newcomer to the community who's working on a homebound primary care program for frail elderly in White Rock, South Surrey. Dr. Moreau, can you tell us a little bit about the program, please?
The program is similar to one that I worked at in Vancouver called the Home Aid Program. And basically all we do is offer primary medical care, plain old-fashioned family practice to frail seniors who are unable to leave their homes to access care from their family doctors.
That sounds like a much-needed program. Why is it necessary for you to take on MRP rather than sharing care with a physician in the community?
Well, this is a very overburdened healthcare system, and right now a lot of people are having difficulty finding a family physician. As a family physician, I can take these patients on, do the assessments, and provide the treatments that are required, and that leaves the other physicians in the community free to do the work that they need to do, whether it's looking after a child with ear infection or delivering a baby. Certainly the more efficient way of doing it is for me to simply see these patients and take them on and let the rest of the healthcare system get on with what it needs to do.
I see. As well as community physicians, would this program also be useful for hospitalists who deal with unattached patients coming out of hospital?
Absolutely. It's difficult for hospitalists to discharge patients in a timely manner if they can't hand over care to a family physician. And there's lots of information out there that tells us that family physicians are very important for ongoing continuity of care for all patients, but especially for frail seniors. So hospitalists can certainly access this service and provide good long-term continuous care to frail seniors.
That does sound valuable. How can a physician refer a patient to your program?
Their information is on Pathways, and otherwise just contact the Primary Care Access Clinic, 604-531-3111, and referral forms have been sent to the physician's offices in the community.
Thank you, Dr. Moreau, for filling us in on this new service. Back to the studio now for the rest of the broadcast.
We will now take a short break for a word from our sponsors.
Fitch, for everything that's community health, now available for South Surrey, White Rock. Fitch is a web-based one-stop portal designed to help the public and healthcare providers access comprehensive information about local community health services. It includes resources that can support the needs of children, youth, adults, and seniors, including, but not limited to, mental health and substance use services, and more. Visit sswr.fetchbc.ca for all your community health needs. The Fetch initiative was undertaken by the division in partnership with Seniors Come Share Society and Peace Arch Hospital and Community Health Foundation as part of our Healthy Community Initiative and the Provincial GP for Me initiative.
It is now time for Dr. Rami Dosanjh to bring you an update on the latest in news from the Child and Youth Mental Health Collaborative and our local action team. Rami?
Thanks, Steve. I've been overwhelmed with the local community support since we launched the local action team for the Child and Youth Mental Health Project in White Rock, South Surrey. This team is 43 members strong and 11 organizations to address the need for improved child and youth mental health services in our community. We are made up of doctors, community workers, schools, counselors, administrators, parents, and at the center of it all, our youth. The team has now formed 3 working groups who will look at improving communication between providers, improving mental health awareness with children and youth, and develop a speaker series. How very exciting. One recent event saw over 60 people participating in a suicide prevention seminar. Our work is much needed and is being very well received in this community. I'll have more updates for you as they're available. Back to you, Steve.
Thanks, Rummy, for that informative report. This is my last broadcast as the anchorman for the White Rock South Surrey Division. For me, it's a moment for which I have long planned, for which nevertheless comes with some sadness. For almost 6 years, after all, we've been meeting like this regularly, and I'll miss that. But those who have made anything of this departure, I'm afraid, have made too much. This is but a transition, a passing of the baton. A great physician and community leader, Brenda Hefford, preceded me in this job. Doctors King, Raffle, and Van Donkersgood have carried the baton, and Connie Rufo will follow. And anyway, the person who sits here is but the most conspicuous member of a superb team of physicians and support staff. And while many will not change, we need to make space for new blood and new ideas. Furthermore, I'm not even going away. I'll be back from time to time with special reports and projects, and beginning this September, I will be your representative at the Society of General Practice. Old division leads you see don't fade away. They just keep coming back for more. And that's the way it is. Wednesday, September 30th, 2015. Good night.